name is Dr. Steve Paragioudakis. I'm an orthopedic spine surgeon. I'm fellowship trained. My undergraduate work was at Johns Hopkins University. I also did some master's work at Johns Hopkins. I then did my orthopedic surgery training at University Hospital at the Rutgers Medical School, and my fellowship was at Stanford University. I've been in practice in Shrewsbury, New Jersey for over 20 years. I'm currently the program director at the Monmouth Orthopedic Residency Program. My professional challenges, I found during my training, I found spine surgery to be the most challenging of all subspecialties in orthopedic surgery. That's what drew me to training to become a spine surgeon. And upon completing my fellowship, I fell in love with spine surgery, and that's been my passion professionally over the last 20 years. With respect to professional achievements, I'm really pretty humble. I like to provide excellent care for my patients. I have received and co-authored a paper that won the Volvo research in spine, and that was quite prestigious at the time. We're very proud of that. I'm also very proud of the residents that we train at Monmouth, and specifically, a lot of them choose to go into spine, and I believe that is a result of the quality of care they see that is delivered not only by me, but my partners and my colleagues also at Monmouth. In our practice, we have adopted and trained and become experts in the field of robotic spine surgery. Several years ago, we adopted this training. We took the time out and underwent several training programs and have really pioneered even some new techniques using robotic technology in performing some spinal procedures that have been present for over the last 40 years. This was challenging initially. However, as I've said, we are one of the leading groups in the tri-state area of doing robotic spine surgery. And this has now equated into amazing patient outcomes, post-operatively. We use less invasive techniques. The outcomes have been spectacular. And we continue to improve upon the technology that robotic spine surgery now provides to patients. And we challenge the robot to provide better outcomes, to enable us to really use the technology to provide patients with wonderful outcomes. We take great pride in our practice with respect to choosing the right surgical procedure for what the patient requires. What does that mean? That means that we're not proficient in just a handful of procedures. We perform several dozen different procedures. And so when a patient comes to us, we take the time to evaluate what their complaints are, what their needs are, what the pathology calls for. And if we determine that a surgical procedure is appropriate for them, we then tailor our surgical experiences and techniques to what the patient requires to provide the best possible outcome for them. When a patient books an appointment to see me, I provide the time and attention that patient needs to express what their concerns are, what their complaints are, where they want to see improvement in the quality of their lives. I believe that that's most important. That's really called taking the history. And I find that in today's environment, with all the challenges that we have, with time constraints, we really pride ourselves in giving that patient the adequate amount of time to give us the correct history for what they are experiencing. Because very often, as we are trained, the history provides 90% of the diagnosis accordingly with the examination. Diagnostic studies, they don't tell the entire story. The patient tells us the entire story. And we take pride in giving them the appropriate environment, care, compassion for them to relay what they want us to help them with in their daily lives.